I'm one of the surgical critical care specialists here at Northwestern, and I run the Surgical Critical Care Fellowship. And part of what I do is ensure that my learners, which are fellows and at the same time residents coming into the surgical critical care, are well educated and, more importantly, are skilled before coming into the unit and caring for my patients. Simulation is an integral part of healthcare system nowadays. It brings up the skills of learners, makes sure that patients are safe, and makes sure that we are all handling our clinical responsibilities in a responsible manner. The couple of ways that we use simulators here at Northwestern is, number one, we introduce it for our learners to introduce them to new skills and patient care schemes. Number two, we actually try training them on simulators before sending them up to the floors so that they can take care of the patients. One of the simulators that we use here at Northwestern, and I use specifically in the critical care unit, is the BRONCH Mentor. The BRONCH Mentor is meant to provide our learners with the education of how to use the bronchoscopies to diagnose and treat and manage patient disease processes. As you can see, the bronch is just like the GI Mentor, and they are instruments that are invasive. They are put inside the patient's cavities, and as such, we don't want anyone to try to do this for the first time on patients. We need to make sure that they are well educated on how they are used, what are the pitfalls of using them, and how they can manage their problems. One of the components that we do with our education is doing the mastery learning schemes, and this is basically providing the minimal acceptable skill and proficiency and competency for our learners before going onto the floors and taking care of our patients. Prior to the age of having these simulators available, we used to have the paradigm of see one, assist in one, and do one and teach one. And all those were on patients. If you do not do it perfectly from the first time, you are more likely to have injured one of the patients. Nowadays, we don't have this happen. Why? Because we have adopted the presence of these simulators in our education and made sure that before our learners touch patients, they are actually skilled and verified that they are able to use these machines safely.